Hello and welcome. My name is Ashley Hawes. I'm the Director for Consumer Information at Benjamin Rose Institute on Aging. Thank you for joining us today for Innovation Collaboration, the Ohio State Plan on Aging. This webinar will be recorded, and we will be sharing the link with all of you in an email in the next week. Please feel free to share the link with any colleagues who could not join us today. You may submit a question at any time using the Q&A or the chat feature at the bottom of your screen. We do have staff monitoring to convey your questions to our presenters and to answer any technical questions you may have. You can turn on captions by selecting Live Transcript, the button with two C's at the bottom of the screen. I'm now going to turn it over to Orion Bell, Benjamin Rose President and CEO, who will introduce our speaker. Orion?
Well, thanks very much. To start off with, I want to thank Bob Blancato and Meredith Ponder-Whitmer and the Elder Justice Coalition for their continued support in making these webinars possible. Thanks to you. Today, we have the pleasure of hearing from an expert regarding the Ohio 2023 to 2026 Strategic State Plan on Aging, which outlines strategies for Ohioans to age well in their communities. Director Ursel McElroy of the Ohio Department of Aging will offer insights onto the Ohio State Plan and how the framework fits into other aging plans across the country. Director McElroy has a wealth of experience in both local and state government, with specific focus in elder care programs aiding those in poverty and vulnerable populations. Her career began in the Franklin County Department of Jobs and Family Services, where she was a case management supervisor, as well as for the Franklin County Office on Aging. Director McElroy served as the chair of the Ohio Coalition for Adult Protective Services through 2008 and worked in the office of the Ohio Attorney General for 10 years as the Deputy Director for Education and Policy, where she managed the establishment of the Ohio Elder Justice Initiative. She also held key roles in the Ohio Department of Youth Services and the Ohio Department of Job and Family Services. McElroy earned her bachelor's degree in psychology and a master's degree in public administration, both from The Ohio State University. Before we turn to Director McElroy and her comments, I will ask Bob Blancato to give us an update to get us started. So, Bob.
Thank you, Orion. And the Elder Justice Coalition is proud to co-host this webinar, and it is my pleasure to add my comments on the introduction of Ursel McElroy, my friend. Our common connection goes back to her days before director, when she was Deputy Director of Education, as you mentioned, for the Attorney General. But she managed the establishment of the Ohio Elder Justice Initiative, one of the more progressive ones at that time and still today. And in her time as director, she has maintained her commitment and leadership in elder justice. I'm also pleased to note that under her leadership, Ohio is one of the few states in the nation to include malnutrition prevention and awareness in their state plan. Ursel is a practical but powerful visionary, and it's an honor that she's able to join us today, and I'm pleased to be part of this. So thank you very much, Orion.
So,
Great. So thank you, Bob, for that kind introduction. It's always an honor to work alongside you. You two are a fierce advocate, well-known expert, and certainly an impressive leader that has championed long-standing and contemporary issues that impact older adults. So it's really great to have a chance to see you here today. Good afternoon to members of the Elder Justice Coalition, those of you with Benjamin Rose Institute on Aging, and everyone on this webinar today. I would like to express my gratitude for being invited to this webinar. A special thank you to Benjamin Rose President and CEO Orion Bell, everyone on your leadership team, and the entire staff for all you do for older Ohioans every day. In fact, I recently had a front seat to see you and your facility in action just recently. Your staff worked hard to make sure that our team and those in attendance had a productive experience. I think we have a few pictures that we can show folks in the audience. For over a century, your organization has been a fixture of Ohio's aging network, helping thousands of older adults and caregivers in Cuyahoga County every year. But we know that your impact goes far beyond Northeast Ohio. So your work to empower all people to age well through research, Consumer responsive services and advocacy certainly reverberates across the state, and it is right in line with our vision at the Ohio Department of Aging of making Ohio the best place to age in the nation. Now, as director of the Ohio Department of Aging, which is a cabinet level agency within Ohio's executive branch of government, I have the privilege to serve as principal advisor and advocate for 2.8 million older adults and their families within our administration, along with administering the State Plan on Aging and overseeing the coordination of long-term services and supports funded by the Older Americans Act, Medicaid, and other federal, state, and local dollars. Understand this has been an incredible time to lead the Ohio Department of Aging, and I am grateful to our governor, Mike DeWine, for entrusting me to make Ohio the best place to age in the nation. Yet, to be the best place to age in the nation, we must be a place where all Ohioans live longer, healthier lives with dignity and autonomy, and disparities and inequities are eliminated. And this is the overarching goal of Ohio's 2023-2026 State Plan on Aging. This comprehensive and actionable state plan serves as a roadmap to ensure every Ohioan can achieve optimal health and well-being as they age. I would encourage you to take a moment to visit our website at aging.ohio.gov. That's aging.ohio.gov to view the plan. You also can access the state plan right now by using your cell phone's camera and scanning the QR code on the slide on your screen. And I would certainly hope you do that at this moment. It will give you some perspective as I talk a bit about our plan. It is a comprehensive roadmap, and it guides our state's aging network on strategies in so many different areas. And as you will see when you open the plan, it includes advancing elder justice and equity and achieving optimal health and well-being for older Ohioans. The state plan really provides us with an opportunity to reframe how we view and approach aging and the healthy aging process. It gives us a chance to thoughtfully assess and, where needed, change some of our strategies as an aging network. I believe it prompts us to rethink our approach to policymaking, service delivery, and investment decisions. When we put this plan together, understand we did it at a time when our workforce is significantly constrained, and our efforts to respond to the COVID-19 pandemic and future health threats are evolving. So we appreciate that the need to act has never been more urgent. This plan is critically ambitious, requires increased investments and innovative approaches to address the immediate needs before us, as well as the obstacles that lie ahead. Failure to adopt and implement our state plan will only perpetuate the very challenges that we realize we are currently up against. So I want to talk a bit about how we got here. Understand, development of this plan is a journey. The strategic, or pardon me, our state plan on aging is strategic. It is a plan that allows us to coordinate and implement activities that the state will undertake to address the needs of older adults, and at the same time, build the capacity of our long-term care system. It was derived from multiple inputs and milestones. So first, we enlisted the support from the Health Policy Institute of Ohio, which is a nonpartisan health policy organization, to help us conduct and subsequently publish the summary assessment of older Ohioans in 2020. During that time, we also conducted a multi-phase needs assessment process, which included an online survey of more than 1,200 older adults with disabilities, and their caregivers. We hosted public hearings and virtual stakeholder meetings to gather input. from the public and to identify some of the local priorities that were outlined by our area agencies on aging. We then used that information to develop what we consider to be a prioritized and specific action plan for our partners, known as the Strategic Action Plan on Aging, or what we refer to in Ohio as the SAPA. That was released in March of 2021. Subsequent to that, in 2022, in February, we published an implementation toolkit. Now, that toolkit was really important because it provided guidance, best practices, tool, and resources for partners so that they too could help us in the implementation of the SAPA. We realized that to build this really strong foundation, we would need the support of many, many partners. And with those foundational steps, we launched our 2023-2026 State Plan on Aging. It was launched in October of 2022 to coincide with the start of the new federal fiscal year. Our plan is a collaborative approach that stands out from other aging plans across the country. The plan calls on all Ohioans, including state and local partners in both the public and private sectors, to join forces to help us realize our goal of having Ohioans live longer, healthier lives with dignity and autonomy. And again, in a way that eliminates disparities and inequities in aging. Now, you first have to understand the hill that we are climbing. You must appreciate what it looks like within Ohio. And this brings me to our life expectancy and some of the information we learned during our needs assessment. Our state has the 6th largest population age 65 and older in the country. Now, according to Scripps Gerontology Center at Miami University in Ohio, our overall state's population growth is projected to be flat between 2015 and 2030. However, during that same period, the 65 and older population is expected to increase by almost 30%. And even while overall life expectancy has increased, this is really important to note, notable disparities still exist. And according to our summary assessment of older Ohioans, our report, which provided a comprehensive picture of the health and well-being of older Ohioans, one of the inputs into our state plan demonstrated that there is a significant gap in life expectancy, depending on the zip code where a person lives. And we found this to be true in urban and our rural areas. We have certain communities within our state. If you look at what's on the screen as example, in our Franklinton area, a neighborhood in Franklin County, which is an urban county, the median household income was $10,000 per year, roughly. And nearly 44% of the population in that community, ages 25 and older, have less than a high school education. There's also a high percentage of Black Ohioans with a disability living in Franklinton. Now, the average life expectancy in this area is 60 years. Now, let's take in contrast the average life expectancy in the Grandview Heights area, a neighborhood also in Franklin County, but the life expectancy is 81.9 years. In that census tract, the median income is about $73,000, and just 1% of residents ages 25 and older have less than a high school education. There's a markedly lower percentage of Black Ohioans in that community with a disability. These two neighborhoods are 4 miles apart. Also, if you consider in Eastern Ohio, Between Smithfield and Steubenville, there's an 18.5-year gap in life, similar community conditions affecting those life outcomes. So statewide, across Ohio, the takeaway is that we have a gap of more than 29 years in life expectancy, depending upon the zip code where a person lives. Think about that, 29 years. People in these low life expectancy areas are missing out on nearly 3 decades of life experiences. And according to the National Institute on Aging, an increased number of adults are living with chronic conditions that may not affect their length of life, but will dramatically impact their quality of life. Understanding that the changing age composition of our state's population requires an aging network that can diversify and expand at a speed matching this rapid population growth is important. Understanding that the complexity of care needs and associated costs are rising, and the consumer demand for services delivered in a variety of settings is increasing. Yet, the workforce infrastructure supported by direct care workers, family caregivers, and volunteers is at risk of burnout at this time. Building the capacity of our aging network is essential, and it requires bold transformation. And this is part of the backdrop of our state plan on aging. So to further understand the complexities of aging and many factors that contribute to one's health, it's certainly important to consider the impact of cumulative advantage and disadvantage. Essentially, the obstacles faced by some individuals, as we know, are far different from the experiences of others. If you look at the image on the screen, the question is, what do these two people have in common? Well, most obvious, they are both trying to get to the same finish line. And for today, let's imagine the finish line as a happy and healthy retirement with all the help and resources needed to live comfortably. Now, we ask the question, what are their differences? So beginning with the woman on the right, her pathway is filled with obstacles. Alone, each obstacle has the potential to impede her. And combined, the obstacles create a greater delay in her time to finish that race. This is a cumulative disadvantage. But conversely, the gentleman on the left has fewer obstacles with more visibility. This increases his chances to run around the obstacles and gain speed or momentum as this race goes on. He has a cumulative advantage. The effects of risk factors, things we are exposed to and experience across the lifespan, accumulate and shape trajectories and the short-term outcomes and in the long-term outcomes. Going through the process of developing the state plan on aging, we understood the importance of acknowledging and appreciating these linkages and the many factors that contribute to one's health, and how it is imperative to attaining the wellness and longevity that so many of us desire. Now, navigating the complexities of aging is personal. Your experience and my experience won't necessarily be the same. Yet there are conditions or social determinants of health that impact us all. According to Healthy People 2030, social determinants of health are the conditions and the environments where people are born, live, learn, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. At the Ohio Department of Aging, we believe the inclusion of aging in the definition of social determinants of health is critical. We respect the aging process as an individualized journey. We believe that health disparities are preventable. We understand the data, that the differences in the burden of disease, injury, violence, or opportunities to achieve optimal health are disproportionately experienced by socially disadvantaged population groups and communities. The Centers for Disease and Control Prevention, or the CDC, specifies 5 domains of social determinants of health that we must focus on: education, access, and quality. That means including access to primary, secondary, tertiary, formal, and informal education, healthcare, and quality, including public health preventative services and the ability to prevent and treat acute and chronic illnesses. Neighborhood and built environment, including environmental exposures and the methods in which an individual's environment promotes or discourages favorable health outcomes. Social and community context, including an individual's social supports, feeling of belongingness, access to community members, engagement in community activities, and their ability to live authentically. And finally, economic stability, including a person's ability to provide for themselves and afford all necessities. Within this domain, many of us also include policy as a determinant of health, rather than having it subsumed in other places. So, when I think about Ohio, and when I think about the complexities of aging, and when I think about the things around the workforce, when I think about the desire for many of us to attain longevity in a very quality way, it is no surprise that our state plan priorities shook out the way they did within Ohio. We came full circle with our plan. We understood it was our pathway forward for us all to work together to achieve the transformation that we need. Our 6 priorities that we laid out were short, intermediate, and long-term targets associated with them. And these are all things that we can work toward to help us improve the lives of so many Ohioans. The first, we're focused on community conditions. We want every older Ohioan to live in a community that supports financial stability, secure housing, and reliable, affordable transportation. Healthy living. We want every older Ohioan to have access to nutritious food and opportunities for physical activity that support healthy aging. Access to care. Again, we want every older Ohioan to have access to the resources and services needed to support health and well-being, and that includes home and community-based supports. This includes workers and caregivers having the supports needed to provide high-quality care. Social connectedness. We want every older Ohioan to have some sort of connection to others within their community. Social isolation must be addressed. Population health. Every Ohioan should have the opportunity to achieve optimal health, including cognitive, cardiovascular, and mental health. And preserving independence. We want every older Ohioan to be empowered to maintain independence as they age, with a particular focus on minimizing chronic pain and falls. Understand, our state plan is not just this aspirational list. It includes strategies to achieve each and every one of these priorities across our state, with particular considerations to be sure that priority populations are included as a part of the solution. This centers around key principles that you also see at the bottom of the screen, elder justice being one. We believe our plan is really an outward expression of our commitment to helping every Ohioan live well. Priority populations are groups of Ohioans within our state that have the greatest economic or social needs and who are at most risk for poor outcomes. We also believe our plan is an outward expression of our commitment to addressing those particular needs. Many priority populations identified based on available data and feedback from expert stakeholders are disadvantaged groups of older Ohioans that often have inadequate access to resources and lack vital supports needed to live long, healthy lives with dignity and autonomy. I think my slide's not moving, so I would ask if you all could advance the slide, please. These groups are more likely to experience ageism in addition to other forms of discrimination. They have increased risk of exposure to trauma, toxic stress, violence, and stigma. They face policy inequities. They live in environments that do not support healthy living, and they lack access to culturally or linguistically appropriate services. So we know that we cannot do this work unless we do it in a multidisciplinary approach. To do this in a way that reduces some of the disparities and inequities, that reduces the elder mistreatment that we see across many of our communities. We know that this work will include engagement across state agencies and traditional aging network partners. I'm going to ask you all to advance the slide, please. This plan includes recommendations for how so many state and local partners in the public and private sectors can collaborate and take action. So this is essentially a call to action. And I want to be certain that you understand that we've laid out 6 action steps to make progress toward our goals within the plan. We encourage all partners, anyone who picks up this plan, and in fact, you're a partner now because I trust that you went on and you scanned the link and that you're flipping through it right now. But some things that we're asking of you: number 1, to align with and focus on one or more of the goals, outcomes, and or priority populations identified within the plan. We also ask you to advocate for funding and policy changes to address the priorities included within the plan. You can fund evidence-informed strategies identified within the plan. Implement one or more of the evidence-informed strategies identified. Partner and collaborate within the different sectors that you see noted within the state plan. And evaluate the progress on the state plan objectives and the impact of these evidence-informed strategies. Right now, we are in the midst of our main operating budget process. And within the department's budget, you will see that we have been very intentional to include those things that reflect investments in healthy aging and longevity. I certainly would encourage you, if you haven't already, to look at the 2024-2025 operating budget process. This is our opportunity as aging advocates for us to lend support. You have the tools at your disposal to understand how critical this time is within our state. This is our moment to identify some of the most pressing challenges with this population that we serve. This is our moment to not only identify those challenges, but to offer well-developed solutions for consideration within this budget. We believe that within our department, Our budget request provides a sound pathway to solutions that support older Ohioans, that strengthens the aging network, and helps ensure solvency of essential funds throughout the next biennium and in the years to come. Our budget is completely aligned with what you will see within our state plan on aging. This is a robust document, our state plan. Again, it includes detailed strategy tables. I encourage you to take a really deep dive into the plan to determine how you can do your part. You can scan the QR code to access the plan or go to our website at aging.ohio.gov. I'm really proud of our plan. We have been regarded as a leader of state plans. One, because we appreciated the need to reframe this narrative around aging. Two, because we connected those things that certainly impact how we age. And three, because we are boldly calling for everyone to help us during this time of transformation. And we are leading the way in how we can best set policy and invest in these really critical areas. And so with that, I'll take any questions that anyone might have. Thank you.
Thank you so much for that really insightful presentation. I hope that everyone took the time to go ahead and scan that QR code. And if you would like to go ahead and submit your questions, again, you can submit them using the Q&A feature or the chat. We did have someone say, and they apologize if they had missed this, but what role did the area agencies on aging play in formulating the state plan?
Absolutely. So they play a huge role. So each of the area agencies on aging first, they also have to create their regional or local plans. And so those plans are included in, it's sort of a two-way process, right? There's an overarching goal or theme that is put forward, or an understanding of the narrative that we're trying to create. And our idea, or ideally, the area agencies on aging within their plans too, will have sort of a similar or align with that thinking. So we hear from them those issues that are most pressing at that level through their plans, because each of them must present and provide for approval their plans. And then with that information, that helps to feed the development of our plan. And so it kind of goes back and forth. It's sort of a bi-directional process.
Thank you so much. The next question, they were hoping that you could please share the budget breakdown because they would love to know how the costing was done.
Absolutely. So we looked at a variety of issues, and I think to start with the budget, I want to, again, give a bit of context for the time we're in. And our summary assessment in the state plan was so timely. Even if I had tried to do my best job, I don't know that I could have landed in such a great spot. But we really understood that we were at a pivotal time in the state, and I would venture to say in this nation, in how we view, how we respond to, how we prepare for, how we invest, how we set policies around aging. When we looked at our opportunity through the budget, we understood that we had a large space to occupy. Right? There were a lot of things that were important, and there were many things that were urgent. And our space in Ohio addresses our healthy individuals who at this point may not require significant or have significant service needs, but certainly could still benefit from having really good policy setting, and for us to think about what their needs may be down the road. We also have individuals who have needs perhaps a bit more. Maybe their needs are more complex. And so we also provide policy and administer programs for individuals that have very little need, but those who are at nursing facility based level of care. And so that is managed through our waiver programs, our home and community-based service waivers, Also, our assistance that we provide through, it could be senior centers, adult day, assisted living, nursing homes, just think the entire spectrum. And so with that, we first wanted to have a demonstration of why it is so important to not only be able to respond to our downstream needs, but also to address and contemplate our upstream needs. And so with our upstream needs, what are those things that we could do at low cost, but have great impact, right? Low cost, high impact for a large number of people. Our healthy aging grants. So we put in the budget a request for $40 million as a pilot, if you will, using one-time funds initially. What these dollars would do is allow us to pass these dollars to the local communities to provide some of those, again, low cost, more upstream services, such as maybe providing home modifications or durable medical equipment, those things that could have great impact, but again, don't cost a lot, but certainly can be the difference between someone being able to stay in their home independently versus moving to a higher cost option or in a setting that perhaps is not their first choice. So I think this is going to be very important and very pivotal for our state, not because of the dollar amount, right, but because of what it represents. It represents a needed shift in our state investments toward those things that are upstream, in addition to those things that are more mid and downstream. And so I'm really excited about it at this time. I do believe, just to give a bit more context for this, because this is a really rich, I really want everyone to get this understanding of where we are in the state. This answer goes even beyond just the budget. But if you look across Ohio, I believe now we're at a place of about 74 of our 88 counties do support or provide some level of support through local levies. Property tax levies provide a level of support for older adults to remain independent in their homes. It is my belief that if we were able to bolster those investments, and by the way, that's to the tune of over $200 million and growing. If we were able to bolster those investments by having state dollars as a part of that effort, again, I believe that it would speak to what we hear the people say they want, and that is choice and independence. And to the extent that we can do that and reserve those higher cost options for those situations that truly necessitate it, one, it helps build capacity in our long-term care system by keeping our funding stream solvent longer. But two, again, it really honors what people say they want. And they want choice, they want independence. And I think we can do this. So the $40 million represents far more than the $40 million itself. I believe it is a pathway, a necessary one, to begin to have investments into more upstream things, those things that I mentioned in the state plan that impact those more long-term outcomes. So that's healthy aging. We also have within the budget, there's a lot of discussion between the agencies that have Medicaid services on the rates for the workforce. Right now, we have through the executive budget put in historical amounts that would raise potentially the wage that's passed through. By raising the rates, it would ideally increase the wage that is passed through to the workers, our care force, if you will, the individuals that really are the backbone of home and community-based services. If we are not able to retain that workforce, if we are not able to truly sustain it, much of the progress that we've made as a state, where we've moved from at a time where only about 10% of the individuals who were at nursing facility based level of care received it at home, and now we're to a place where more than 60% can receive that service at home, all of that is at risk. That is not a statement to be dramatic. That is factual. And we do not want to erode that great progress that has been made. We also have within our budget some increases to some areas where we know the support is needed. Alzheimer's and other dementia respite line items, as an example, we've asked for increases. Families simply are exhausted. Families need the support. And so we're asking for those increases to be carried out within this budget. We've asked for within the budget, obviously, to retain some of our critical services, to take no cuts. You'll also see throughout the budget, we talk about some policy shifts that we'd like to make. For example, we would like to, in addition to our state plan on aging, to have a required economic report on aging, so that when each budget process presents itself to us, that there's a clear picture, a thoughtful picture on the impact of aging in this state, given the considerable amount of discussion and cost that impact aging Ohioans. So those are just some examples. Understand, we are really talking about reframing aging. We are really calling upon our leaders in this budget process to understand how important aging issues are in our policy making and the investments that we make, and just the overall future of our state.
Thank you. We did have an attendee who would like to know if you could share some best practices on how the business sector, secondary education sector, et cetera, were engaged in order to support the state plan.
Absolutely. So when you open the state plan, you can see in there are a multitude of partners. And we called upon those individuals that we certainly believe could be a part of this work. But we also understood that there could be some sectors that maybe weren't included that could also be a part of the implementation of the work. I would ask for folks to look at three of the documents, because you really have to see all of them, I would argue, to really understand the progression and to appreciate where you believe your sector can be most helpful. That summary assessment for older Ohioans that I referenced, that was published in 2020, really gives you an idea of the areas that perhaps need more assistance or could be bolstered. I think if I had a business, I would look to see where in the state am I seeing some of these critical gaps, and are there opportunities for our sector to be able to help fill some of those gaps? That's the summary assessment. When you get to the strategic action plan on aging, and what we refer to as the SAPA, which was released, I believe, in 2021, then you'll see in the SAPA a very well laid out, actionable plan. In fact, when you look at it in its electronic version, there are many links in the back with the objectives, the strategies, and how you can track that work. You can click on there and you can find so many different places and so many domains where you could be impactful. We designed it so that it wouldn't have to be driven, right, and managed solely at the state level. The reality is that's not going to accomplish what we need. This has to be done by so many different sectors, public, private, different industries. We have to think of ways across the state that we all can be a part of this solution. So you can certainly find yourself in there. There's an implementation toolkit that follows that SAPA, or is a companion document to the original SAPA. That toolkit was designed so that you could pick it up and say, okay, these are the concrete steps that we need to take to be a part of this. And then finally, the state plan on aging. That is the document where we have signed off and demonstrated our commitment to the federal government, to our state, to say, this is what we will do, and this is how we will do it. So you have all of those things laid out before you. I'm not suggesting you have to be a scholar in this. I'm saying in each one of these documents, if you're anything like me, you want the executive summary, they all have one. and it will point you to where you need to go to access the specific information that you're looking for.
Thank you so much. And are you able to speak a little bit more about the evaluation process for the plan? Who will be tracking the progress towards the objectives, and how often this information will be shared?
Right. So we have a division. It's known as the Elder Connections Division. And within that division, I have really great experts. They're leaders, they're experts in population health. They have designed, and I believe within the plan, it lays out where our checkpoints are. We have, if you recall, in both the Strategic Action Plan on Aging and the State Plan on Aging, we have our near term, our midterm, and our long-term checkpoints. And so within there, I think it perhaps provides a bit more specificity of when those are and how those will be measured. Each one has different measurements for them.
Thank you so much. So this next attendee, they had a comment and then a question. So they said that the theme noted innovation, however, many programs deliver services that may not meet the actual needs of the individuals that you noted earlier. So they were hoping that you could please share how ODA is accessing or engaging with innovative initiatives.
Absolutely. So I'm glad you asked for the question. So when you talk about innovation, I'll give you some recent examples and how all of this sort of moves us into innovation. We always do things with an eye toward the future. So while we're certainly looking to enhance the current aging network and framework for today's older Ohioans, we're always building for future older Ohioans. A couple of examples right now in the state, we have what's known as, and many of you may be familiar with PACE, the Program for All-Inclusive Elderly. It's a program that, while not a new program itself, it does provide for those individuals at a nursing facility-based level of care, for them to be able to receive that care still within their communities. It is primarily a adult day setup where an individual goes to the setting at a regular cadence. It could be a few times a week. It could be perhaps more than a few times a week. But in this particular setting, it is managed by or operated with a robust interdisciplinary team, a geriatrician, it could be nurses on staff, social workers, therapists on staff. You can receive your occupational therapy, your physical therapy, your medication management, pretty much the entire suite of services that are available to you through Medicare, Medicaid. All of those things are generally available to those participants. Where the innovation comes in is that here in Ohio, we have one provider in one area, and you happen to be in Cuyahoga County, where Benjamin Rose Institute is the beneficiary of that, but we don't have that statewide. What we're doing is standing up a network, and it's my understanding, and speaking even with the national PACE organizations, that no other state has done this at the speed of which we're doing it and at the level of excellence that we're trying to create on such a short clip. I'm really excited to say that an RFP will soon be released. If it hasn't already, we're on a really fast track here. I'm talking here within weeks will be released, if not already, where we will be able to stand up no less than 6, potentially 7 across the state within the next couple of years. That is significant. And some of the innovation in terms of connecting and creating a network that has the ability to learn from one another, build from one another, use technology, infusing technology to do that, certainly speaks to innovation. Second, Alzheimer's. I mentioned our budget speaks to Alzheimer's. I want to take it a step further. We chaired an Alzheimer's disease and related dementia task force. And through that work, it became abundantly clear that yes, while we certainly want to address the needs of the individual that is experiencing the disease process, we also have to be cognizant of the decline often felt by the caregivers. And so we released an RFP after really looking at how can we create a resource center? What should be the elements of that resource center? One of those elements, and there are multiple elements, including screening tools and education and training for professionals, but one component that I'm particularly excited about is the establishment of a caregiver center. We were able to establish this with a partnership with the Ohio State University College of Nursing. There actually is a physical plant, so brick and mortar. I had a chance actually to go and see the space just maybe a week or 2 weeks ago. I'm really excited about it. It will be available to Ohioans here shortly. And this will be one of several that we intend to stand up. It will have both walk-in and remote capabilities for caregivers to receive the support, the information that they need so that we can continue to help them thrive because they are a critical part of this infrastructure. So I pride myself and I pride the report on being a very innovative, forward-looking document that has a bias towards action that contemplates not only the now, but also the future.
That's great. So we do have time for one last question. Someone was wondering if you could please advise if Ohio is exploring a multi-sector plan for aging, and if so, how the state plan may intersect with a multi-sector plan and age-friendly initiatives.
Right. So I'm going to first say that our plan absolutely is a multi-sector plan on aging. Listen, I understand that there's a designation out there, and I will tell you, we've done our due diligence to research this. And from our discussions with our federal partners, from our understanding with our colleagues across the state, we believe that we have a plan that checks all those boxes. And I'll just take a point of privilege here and then some. In fact, we hope that we'll be able to work with those who are establishing multi-sector plans so that we can help them in putting together a plan that is so comprehensive, that is so forward-looking, that is so rich with information, and is built in a way that ours is. And so we appreciate the concept of a multi-sector plan, but make no mistake about it, our plan is that and then some.
That's wonderful. Okay, well, we want to thank you, Director McElroy. That was such a great presentation. You shared such wonderful information that I know that we all just really appreciated and are able to take that information and really apply it to going in reading through that state plan and being more familiar with it from now on. And we'd also like to thank the Elder Justice Coalition for making today's webinar possible. Thank you all for joining us. In the chat, you're going to see a link for a webinar evaluation that we hope that everyone will complete. Your feedback's very important to us because it does help us improve our programming. The link will also be shared with you in an email soon. And as I mentioned earlier, a recording of today's session will be made available. We'll send it to you, and it'll also be made available on our website, which is www.benrose.org, and it's going to be in our resource library. To stay up to date on all of our webinars and all of the events that Benjamin Rose has to offer, such as our upcoming Dementia Friendly Cleveland Heights Week that will be held May 15th through May 20th at the Lee Road branch of the Cleveland Heights University Heights Public Library. Again, please visit our website, www.benrose.org. And more information about all of Benjamin Rose's research, services, programs, and events can also be found on our website. Thank you all for joining us today, and we hope that you have a great rest of your day.
Thank you.
Thank you.